What's up, guys? It's Dr. Steve. One of my patients asked me to make a video about some of the rehab stuff that I do here at the clinic. One of the exercises so that he could do it from home. I figured all the rest of you guys could benefit too. So I was just going to do a quick review of the quadruped track exercise that I do here in the office. That's supposed to help people learn spinal neutrality and how to kind of move their hips and shoulders independently from moving their spine, which can help out a lot with people that have recurrent low back pain, things like that, where their backs kind of go out pretty frequently. A lot of times I see that that's related to having some poor muscular control in your low back. So this exercise is a really good way to learn some of that. It's part of a progression in a series of different exercises that I use for my patients, but it's a pretty good one all around for everybody to try. So it's derived from a yoga posture, and we end up kind of progressing from a pretty easy starting point to making things pretty difficult towards the end, learning some balance and how to kind of keep our pelvis in line when we try to challenge it with a few different movements. Some common mistakes that people make is that they kind of let their pelvis move a little bit too much and drop to the side. They're not very aware of their posture in general, so I'm going to show you a couple ways of how you can start there using a stick here to kind of find where a neutral spine position is and then use your bracing techniques in order to keep your spine in a good natural state while we're kind of moving our arms independently, which should kind of benefit us as we're moving around in the world so that we're not putting a lot of undue stress on our spine, which can cause pain and injury. So the first thing we need to be able to do is get into this tabletop position here like this. Usually we want wrists underneath shoulders, knees underneath hips. Then you can use a bar or a broomstick handle or PVC pipe or something like that to find a good neutral spine. Basically what I look for when I get people set up in this position is that we have 3 points of contact. One here at the head, one in the mid-back, and then one at the tailbone. What people like to do when I tell them to touch their head to the thing is that they look up like this, and that's not right. What I want to see is that we bring our head back so that our ears end up over our shoulders, which is a good postural position. After we've found that, we can start progressing. What I usually get people to start doing is leg movements first. So we want to keep those 3 points of contact, move nice and slow, and reach out like we're trying to touch the wall behind us, keeping our pelvis in a good line so that we're not collapsing to one side or another. One thing that you will notice is if you feel your knee hit the ground early, or you're feeling like you have to set down, and then that's a good chance that your hips are kind of moving while you're working this extension thing. What you can do at that point, if you're feeling a lot of movement that way, is put the stick down low here across your hips, get into this good position, and now you should be able to feel if that stick is wobbling while we're going from side to side. What you'll notice is if we're going from this way and I really open up, that stick's going to fall off there, and that's not what we want. So get through working in this sort of long axis stabilization first, getting to the point where we can do alternating legs pretty simply, trying to reach out and touch the wall as far back as we can, feeling a contraction here in the glute, and then start working on arms, same thing, which is usually pretty easy for people, and then combining them here like this, and then starting to work on that sort of transverse stability by putting the bar down in the low back. Same sort of thing, starting with legs first, then working arms, and then combining them. And once you get really good at that, you can take the bar away, and we can just kind of work on these bracing techniques on our own. Same sort of thing, just crossing back and forth so we're not moving a ton. And then what we can work on is adding a little bit of a challenge here by drawing a box out in space and setting down in between each one. Also trying to do same-sided balance here, which can be a little difficult. And then working on getting to touch and go from the same side. So that's about as a good progression as you can get as far as these things go. You can add ankle and wrist weights too if it gets to be too easy. Ideally, you should be able to do about 20 or so repetitions on each side, with each repetition taking between 3 and 5 seconds before progressing to the next little bit. If you have questions about any of these exercises and what other ones may benefit you, then go ahead and ask at your next appointment or make an appointment and see if I can help you out. Okay? Have a good day. Bye.